video. So in this video, I just want to give you guys an update on how work has been for me. If you guys have been following along, a couple months back I had told you guys I had started a new job and I was uber excited about it. So I just wanted to update you guys. So currently I work at a medical spa and a doctor's office. This doctor's office and medical spa is ran by the same doctor, and the offices are literally side by side. So on a given day, on the doctor's office side, I do hyperbaric therapy. Basically, it's when a patient goes into a chamber where 100% pure oxygen is delivered, and the thought is that the oxygen heals you inside out. So it's good for things like gangrene. It's been thought to work for people who are going through chemo, people who have artery insufficiencies, and an array of other things, like even for like some head trauma patients, it can work for. So on a given day, I do several of those for a number of patients. Also, I work on the medical spa side. So the medical spa side is what I really love because it offers me the opportunity to use skills that I would use as a nurse on a day-to-day basis. So there I have learned how to do all type of injections, from subcutaneous injections to intramuscular injections and things like that. And there I only inject things like vitamins. So your vitamin C's, your B12s, and your lipolines and things like that. Those are things that I am able to do. When it comes to the medication, of course, I have to be supervised by a physician because I'm not licensed yet. So I have had the opportunity to prepare some of those medications for the doctor, but not actually give it. I've also got an opportunity to use my skill sets that I learned in like lab, like starting an IV line and things like that, and drawing blood. I've got the opportunity to do that on some patients at the medical spa side. I won't say that I'm super proficient in that just yet because that's something that takes time. Because just when you think you got everything all figured out and that you're good to go in those skill sets, then a patient will show you out. Like for instance, you can have a super obese patient that makes it hard to find their veins. Or you can have a person who may come in for, like, let's just say a rehydration IV fluid, and they want fluids, and then they're so dehydrated from being drunk and hungover that you can't find their veins. Or, you know, you may have a person who's real frail and elderly, and you may have a hard time finding that vein. So, you know, every now and then you may get those tricky patients here and there. But every opportunity that I do get a chance to practice those skills, which I'm thankful for. We also do cryotherapy, which is pretty cool. If you guys aren't familiar with it, it's where people go into a chamber that's like negative 250 degrees, and they sit in it for up to 3 minutes. And the thought is that it has several benefits for like pain management. It can help you burn anywhere between 600 to 1,000 calories and things like that. So we get a lot of people who like doing the cryotherapy. It's pretty laid back, it's pretty chill. On a given day, I work very autonomously. Like, I don't have anybody breathing down my back or watching me, which I enjoy. That's awesome in any job. You don't want anyone breathing down your back. Trust me, it's annoying. So I like that the doctor gives me the autonomy to just do whatever. I also get the opportunity when it's downtime to do my schoolwork, which is also an additive and a bonus for any job. Most jobs you don't get that opportunity to be able to do your schoolwork. And then also I can pick up hours when I want, I can drop hours when I want. So if you ask me, I think I'll keep this job till I graduate from nursing school and then transition to RN to do something somewhere else with, you know, who knows? I may end up in another doctor's office or anything like that, because ideally I want to do cosmetic nursing. So he would be a good person for me to keep as far as a reference and as part of my network for me advancing and growing into the field of nursing. So yeah, that's how work has been going for me.